We are going to head right into our next session, which is abstract presentations. And so this will be kind of a rapid fire watching of videos with a couple minutes of questions for each talk. And the theme is emerging practice and research on global issues and local solutions impacting maternal child health. So to start, we're going to hear from Clay Jones from the Maricopa County Department of Public Health, and their abstract is entitled From Stigma to Hope to Healing, a Shift in Perspective on Prenatal Substance Exposure.
Hi, good morning. I had some audio difficulties, just had to get typed in.
No worries.
I missed the last one.
I think Liz is going to play the recording and then we'll open it up for questions after. Right, Liz?
Hello, my name is Clay Jones of the Maricopa County Department of Public Health in Phoenix, Arizona. And I'd like to share some information with you about a new initiative here called Maricopa Shift. Safe, healthy infants and families thrive. This is an initiative that was implemented recently as a result of the ongoing opioid epidemic that's been plaguing the country for a number of years and is targeted for expectant women with substance use disorder. I have no conflicts of interest to disclose today. So the opioid epidemic has been ravaging the country for a number of years. And in fact, every day we lose about the equivalent of an airplane full of people to lives lost every single day in the United States due to overdose. Most of those are a result of opioids, and many of those are a result of prescription opioids. One of the consequences in newborns exposed to opioids in utero with the diagnosis of neonatal abstinence syndrome, or NAS. This is a drug withdrawal syndrome that occurs in some infants that are exposed to opioids in utero. While total births across the country have been in decline for a number of years, the rate of NAS diagnosed newborns has been skyrocketing for some time. You can see in 2009 in Arizona, we averaged about 1.5 births per 1,000 with an NAS diagnosis. By 2020, it's almost 10 babies per 1,000, resulting in almost 800 babies a year born with this diagnosis and medical complications. In Arizona, we have at least 2 babies born every day with this diagnosis. These are usually covered by Medicaid, and you can see the dramatic difference in costs of NAS births versus a typical birth. So the solution to this dilemma is an initiative that's been underway in Vermont for a number of years called CHARM, Children and Recovering Mothers. Vermont's CHARM initiative is the only SAMHSA-endorsed initiative of its kind, targeting expectant women with substance use disorder in non-stigmatizing collaborative care prenatally. This is the key, before the baby's born. They're seeing some remarkable outcomes. For example, the vast majority of their newborns do not require medication for NAS, which is typically morphine given to the newborn. They see an average increase in the average baby's birth weight. Low birth weight is a common outcome for NAS babies, and they're seeing more and more babies going home safely. This also results in lower cost for delivery, less time in the NICU, less cost assistance, including Medicaid. The key to all this is prenatal enrollment, engaging these moms before the baby's born to come up with a plan for that baby to go home safely and to have all of the different providers in different silos working collaboratively. So Maricopa County is the 3rd largest public health jurisdiction in the United States, serving the greater Phoenix area, 4.5 million people. And we're implementing a Maricopa Shift version of the CHARM Collaborative in Vermont. And part of that, we're promoting some best practices. For example, compassionate, non-stigmatizing care. And expectant women with a substance use disorder is one of the most highly stigmatized patients/clients that you'll ever work with. And as professionals, we need to be mindful of the language we use and the way we treat our patients, clients. So we're promoting our systems being trauma-informed and also infant mental health informed. We're promoting universal screenings with a tool called the 4Ps Plus. It's the only universal screening tool validated for expectant women with substance use and domestic violence. We're promoting collaborative care between all the different providers in various silos, such as OBs, substance use disorder treatments, home visitation, legal, court involvement, child welfare involvement, anyone that touches the lives of this population. It's a huge task because we have thousands of professionals in our county that all touch the lives of this population. Another best practice we're promoting is what's called the Eat, Sleep, Console approach. This is a method of treating newborns in an alternative nursery rather than in the NICU, which engages the parent as the primary first solution for relief for the babies who can be difficult to console, along with a supportive coach, versus the traditional NICU Finnegan model. The Finnegan is a tool that's been widely used for many years, and it's not evidence-based and validated. But the Eat, Sleep, Console approach is. I quote at the bottom Dr. Grossman, who is the researcher behind this. This approach is gaining more wide acceptance because it's family-friendly, baby-friendly, has better outcomes, and reduced costs. For eligibility for Maricopa Shift, there's only two criteria: an expectant parent with a substance use disorder of any kind. And I remind our staff to be mindful of nicotine, alcohol, and marijuana, 3 legal substances in Arizona now. However, in pregnancy, there is no safe dose for any of those. There's no wrong door for parents to become involved. Multiple points of entry. They could be referred through their doctor, through a home visitation, through a substance use provider, their court involvement, or they can self-refer directly by contacting us. If a provider refers us, those referrals come to us securely to the shift coordinator at Maricopa County Public Health. Once we begin that, we begin the collaborative process, and the client consents to all providers to share information with each other. Upon early enrollment, we're interested to find out what services the family is engaged in currently and what kind of needs they think they have. We have some major categories listed here. Our priorities, of course, are prenatal care for the baby and substance use treatment for the parent. So if the parent is not engaged in both of those will be our priorities. Then we work with the parent to identify gaps in services, and in partnership with all of our collaborators, we partnered with over 30 agencies and programs throughout Maricopa County to become aware of this. We provide the family with this binder, and the binder is an important key. The parent can keep track of all appointments, can keep records of services completed, certificates of completion, and most importantly, the prenatal family care plan, which is a plan of safe care document that outlines all services for the baby and the family upon the baby's birth. The idea is once that baby is born, if child welfare becomes involved, the parent can present this to child welfare and show them all the planning and the preparation they've made ahead of time for that baby to go home safely. I'd like to share with you a 30-second parent testimonial. This can be found on our website, maricopashift.com. And this features a young woman, Clarissa, who is one of our collaborators. She has a lived experience herself, and she now works as a peer mentor and a doula with one of our providers. Here's her story.
Taking care of an infant is not easy, but taking care of an infant that is withdrawing is even harder. There's a new program called Shift. Shift can help you connect to different agencies all around the county. When I finally got help, I found all of these different services and all of these different agencies that can help me with education, with my recovery, with substance abuse treatment, mental health treatment. You're not alone. Taking care of an infant.
That is Clarissa's story, quite remarkable. We're very proud of her and lucky to have her as one of our partners in one of our major providers. Maricopa Shift has been in development for about 5 years, and we just recently launched in December, and we're starting to receive referrals. And here's our contact information. Would love to hear from you. Again, my name is Clay Jones with Maricopa County Public Health. The easiest way to reach us is through our website, maricopashift.com. There's links on every page to reach us. We have a phone, we have a dedicated email, and you'll usually reach me. And I look forward to hearing from you. Thanks. Have a good day.
Thank you so much, Clay. We can open the floor for questions. Feel free to type them in the chat, or you can unmute and ask your question. I do see one question already in the chat from Renee. She asks if there's anything similar for other counties like Gila or Cochise County.
Good morning. I just saw that, Renee, in the chat, and that is a great question. So we contracted with a marketing company to help develop our website, our verbiage, our images, the printed materials, and we have been kind of thinking ahead. So we've actually created matching shift logos for all 15 counties that look just like the Maricopa shift, Coconino shift, Gila shift, and so on. And just recently, we began discussions with Pinal County, and we had another meeting yesterday with them. They're probably way ahead of where we were very early on in this process. And Coconino County is starting to express interest. And Yavapai Shift is also in operation. Yavapai Shift launched around the same time we did in December. So those are the ones that are kind of in the exploration development point at this point. And so we anticipate probably eventually we'll have this in all 15 counties. The interesting thing is then, so these other counties, they come to us, to kind of point the way while, we're happy to do that while we're still busy developing and implementing our own. So that's a great question. So I encourage you to talk about it with folks in your county. If you can get involved, your juvenile court dependency, presiding judge, your DCS, APMs, folks like that, people in leadership positions in your jurisdiction, and reach out to us. And we will encourage you to start with a small core of leaders and schedule some meetings to share what we learned. Yeah. So great question.
Thank you so much, Clay.